So what I'm going to talk about this morning is mental health following the Deepwater Horizon spill. We'll talk a little bit about sort of generally what the literature has shown, and then we'll get into talking about a variety of different projects that we've been involved with at LSU that get at different angles on the question. Okay, and you know, the bottom line is and Richard talked a little bit about this too, that there's no perfect way to get at any of this stuff, right? So there's sort of strengths and limitations associated with different approaches, and that's one of the things that I want to talk about this morning. Okay, so everybody's familiar with the Deepwater Horizon spill. You know, obviously this was a big disaster that occurred about 50 miles off the coast of the southeastern part of our state, resulting in 11 deaths immediately. The wellhead breach gushed, you know, they estimate hundreds of million, over 130 million gallons of oil into the Gulf over a 3-year period, or 3-month period, I should say. So it was a lot of oil, and as everybody's aware, we had a lot of trouble capping the wellhead. It's the largest marine oil spill in recorded history, and it set in motion unfolding processes of ecological and social damage, right? So issues related to water quality and natural environment, but also, as people have been talking a little bit about, and we'll talk about more this morning, had impacts on health and social functioning and so forth. Just some guiding ideas related to our work. Sort of the broad concepts that guide our work are resiliency and vulnerability. And so when we're thinking about disaster resilience and disaster vulnerability, what we're talking about are the attributes that people possess, either at the individual level or community or regional level. You know, you can kind of conceptualize these different social levels, but they're the attributes that people possess in terms of resilience, the attributes that people in places possess that either shield them from negative disaster impacts or provide adaptive capacity, right? The ability to adapt to a shock to the environment, adapt to changes in the environment, and allow them to cope and recover. Vulnerability, on the other hand, refers to attributes of people and places that make them more susceptible to negative disaster impacts. Okay? And so the idea is that we all possess a variety of social characteristics, right? What sociologists call a status set, right? And that status set at the individual level, the community, and so on, right, makes us resilient along certain dimensions and vulnerable along others. Okay, I realize from standing in the back of the room that probably no one can see this figure, so I'm just going to try to walk you guys through it a little. The basic idea is that you have, at the top, you have community resilience attributes. And this is just a figure that sort of lays out a conceptual framework for thinking about resilience and how it might impact mental health. Okay? So we have community resilience attributes at the top, individual resilience attributes at the bottom, right? And then people possess different levels of human capital, that is, education and skills and so forth, economic capital, right? People's finances, jobs, and so forth. Social capital. This refers to the relationships that we have with others and the connections that we have to people through our group memberships and so forth. Political capital, the way in which people are networked or not networked into civic community, right? And these things sort of interface between the individual and the community. Then you have the exposure to harm. In this case, right, we'd be thinking about people's exposure to the Deepwater Horizon oil spill. And as Richard was talking about, we can conceptualize exposure in different ways. There's obviously people that had direct exposure, right? People that had exposure through the air, right? And then there's people that have sort of these indirect exposures through job, and family, and so forth, right? But we have exposure to the oil spill, and then people's differential ability to kind of activate resilience, right? And then ultimately impacts on mental health. Okay, so what do we know about the relationships between oil spills and mental health? Most of what we know, we have a growing body of literature that's focused on the Deepwater Horizon spill itself, but there's also a really large body of literature that Lisa Ritchie especially has contributed a lot to, and she's going to be speaking next, related to the Exxon Valdez spill. It's pointed to a range of different impacts between disaster experiences and individual well-being. So the majority of these studies, I should say, are cross-sectional in design. So what that means is we have a sample of people at a specific period of time. Okay, so we have sort of a snapshot of what the impacts are at a particular period of time. You can have, and I'm going to talk a little bit more about this, you can have repeated cross-sections, right, where you have snapshots of the population over time, but each of the samples is composed of different people, right? And then you can have longitudinal studies, right, which are following the same people over time. Okay? And all of those different approaches are going to let us examine different kinds of relationships. What the previous literature tells us is that oil spill exposure is associated with a higher prevalence of post-event distress and stress, higher rates of depression, anxiety, and PTSD, post-traumatic stress disorder. Okay, so all of these, kind of psychosocial stress, depression, anxiety, PTSD, all of these are known to be associated with oil spill exposures. And importantly, we also know that social and economic support act as moderating forces. Okay, so these are variables that intervene, right, with you have your exposure impacting mental health, right, and then you're going to have people that have different levels of social support, right, through their families and communities and workplaces, people that are going to be in different economic circumstances, right, some people of more modest means, right, that might be really struggling already financially, other people that have the financial cushion to absorb a shock in their social environment, right? So social support, social and economic support act as moderators to kind of intervene with variables in this relationship. Okay. We also know that children can be differentially impacted. Right? Children are vulnerable in a lot of respects in terms of their health and frankly in terms of the fact that they're dependent upon the adults around them, right? So we know that the experience of disaster often unfolds differently for children, and because children rely on adults for safety, consistency, and support in their environment. Families often experience negative economic effects following an oil spill, right? Those economic stresses, right, lead into other kinds of stresses in family and social life, right? I mean, you can think about all of the ways in which economic stress impacts family functioning and the lives of children, right? And when you have a big shock to the environment, that will impact things. Okay, so we also know that for children, spill exposure is associated with the increased risk of mental health distress and lowered academic achievement. Okay, so kids are stressed out, and they often, in turn, do worse in school during these periods of time. Okay, so I want to talk about a little bit about three different studies that we're involved with at LSU. All three of which have been funded by the Gulf of Mexico Research Initiative, so I want to give Gomery a shout out on that. And then when I talk about the Resilient Children, Youth, and Communities, RCYC study, I should note that we also received some initial funding from Baton Rouge Area Foundation, or BRAF. So the community oil spill study was a repeated cross-sectional survey that we conducted looking at the social and economic impacts related to the BP spill. I'll talk a little bit more about that in a second. We have the Consortium for Resilient Gulf Communities. This was a project that's led by colleagues of mine at the RAND Corporation. The principal investigator, Melissa Finucane, is going to be here tomorrow talking a little bit about risk communication. But we had a bunch of different institutions involved, or that are involved with the CRGC, including folks at South Alabama, Tulane, the RAND Corporation, Louisiana Public Health Institute, and LSU. And then the last study, and this is what Catherine's going to talk a little bit more about too, is what we call the Resilient Children, Youth, and Community Survey, or RCYC. It's a collaboration between folks at LSU and people with the National Center for Disaster Preparedness at Columbia University. Okay, so the COSS study, and I'm going to walk through these and just kind of talk about what they do, kind of a little bit about strengths and limitations, and then some key findings. So the COSS was a telephone survey of about 1,000 Louisiana residents in the coastal areas of Plaquemines, Lafourche, and Terrebonne parishes, as well as Grand Isle. Okay, so across the coastal portions of these places, their total population of around 6,000 people. We surveyed about 1,000 of them, and what we did was a repeated cross section. Okay, a repeated cross-sectional survey. So we didn't try to interview the same people over time. Okay, we tried to get a representative sample of the population, okay, at different points in time. Okay, so it's different people are being interviewed across the different periods. So we had a sample. Our first set of surveys was conducted in June 2010. So this is when the oil was still flowing. Then we conducted another survey following up on that in October 2010. So this was just a few months after the well was capped. And then we followed up with people on sort of the 1 year, 2 year, 3 year anniversaries in April 2011, 12, and 13. And again, we asked people a whole range of questions about health and social well-being and so forth, but just a few key findings that I think are important to think about. One is that we have a number of studies that have showed disproportionate negative impacts on the mental health of fishers. Okay, and the reason that fishers are important to think about, we have a concept in sociology called renewable resource communities, or RRCs. Okay, and the idea is that when you have people that are dependent upon a renewable natural resource, right? A threat to that resource in the environment, like an oil spill, right, is going to cause disproportionate stress on that community, right? A kind of stress that may not be felt by folks who are not directly tied to that resource as part of their livelihood and identity. Right, so we've seen disproportionately negative mental health impacts on fishers. We also showed that in the first sample, in this June sample, that greater community attachment was associated with negative mental health impacts. So that was people that were more attached to their local place, right, were having worse mental health outcomes, okay, as a result of the spill. But what we also have showed with the follow-up surveys is that people that were more attached and more integrated in their communities, okay, also recovered their mental health more quickly. Okay, their mental health recovered more quickly. Okay, so we saw greater initial impacts because of people's embeddedness. Okay, but that over time, that social support initially it was a factor that led to vulnerability, right, and over time, resilience. Okay, the CRGC, we've approached things a little bit differently. I'm cutting into Catherine's time, so I gotta get moving here. This was a longitudinal. We're doing a longitudinal survey of about 2,500 coastal residents in Texas, Louisiana, Mississippi, Alabama, and Florida. So we had an initial survey that we did across all coastal counties and parishes in 2016, and now we're in the process of following up with the same set of people. Okay, and what a longitudinal survey allows you to do is say what's going on in terms of change change over time for individuals or within families, right, within units of analysis. We also have a Harvey sample in Texas where we're asking people the same kinds of things about vulnerability and resilience in the context of that hurricane. Okay, so what are some of the things that we found from the CRGC Strong survey? The first is that oil spill exposures significantly linked to greater illness anxiety. Okay, people that were exposed to the oil spill are really stressed out about their health. Right? They don't know if the oil spill caused it. They don't know if it's coming from somewhere else. But people that were exposed to the oil spill are anxious about their health and illness. Okay. We also have findings showing that greater. This is looking at fishers, right? Thinking about renewable resource communities or RRCs. We have findings showing that greater social support was linked to lower odds of depression among people who are not fishers. Okay, and this is what you would expect, right? That people that are more networked in, right? That have greater social support, that'll act as a buffer against depression. Right? But that we actually see the opposite among fishers. Fishers with greater social support, fishers that are more networked, okay, report higher odds of a positive depression screen. Okay? And we suspect that has to do with the kinds of networks that people are part of, right? The tightness, the kind of the tight-knit fisher communities. Right, that these are networks of people that are under a great deal of stress and strain. Okay, and so with that, I'm going to turn it over to Catherine.
Hello, my name is Catherine Keating. I am a third-year PhD candidate at LSU in sociology. I also have a background in social work, and it has been my privilege since 2016 to have worked in Southeast Louisiana as part of the Resilient Children, Youth, and Community Study. And I'm just going to get in a little bit deeper about some of our methods. This is an active project, so I'm going to talk a little bit about what's going on now and go over some preliminary findings. So the RCYC study is the Resilient Children, Youth, and Community Study, looking at social and public health impacts with an emphasis on children and families and understanding their experiences following the spill over time. So it's what we call a mixed methods project, which means we use several different components to sort of get at the questions that we have about these social and public health impacts. So the first component is a three-way longitudinal data set. And as Dr. Slack mentioned, longitudinal means we follow our respondents over time. There's also a focus group component of the RCYC study, and a social media analysis, and I'll talk a little bit about each of those components. All right, so general objectives of RCYC. So questions we're asking, what are the social and public health impacts of the Deepwater Horizon oil spill? What qualities of households are related to greater resilience? And how does social networking play a role in resilience, if at all? And how do these things change over time? So to start with, I'll talk a little bit about the face-to-face household survey. And when I say face-to-face, I mean that we have field interviewers that go to our respondents' homes, sit down with them, and conduct around a 45-minute survey on a tablet. It's very conversational, but it's guided by a series of quantitative questions. So it's a 3-wave survey. The first wave was in 2014. We were able to interview 655 parents living in Southeast Louisiana across 7 different parishes, so St. Tammany, Orleans, Terrebonne, Jefferson, Lafourche, Plaquemine, and Vermilion. And all these parents had a child who was under 18 at the time of the Deepwater Horizon oil spill. So in 2016, 2 years later, we followed up with the same parents, and we were able to get a hold of 484 of them. And the final and third wave is wrapping up right now for 2018, and we are hoping to meet or exceed that 484. So we have a lot of people in Louisiana who are invested in the survey and continuing to follow up and meet with our field interviewers, and that's what creates the research and gives us the information that we need. It's really great. So that longitudinal design allows us to capture change over time within our individual respondents and their households. And the survey, like I said, is about 45 minutes. It captures a variety of questions related to social and health impacts. Specifically with mental health, we have questions that include different scales and questions about different types of health symptoms for parents and child, and also some questions about trauma and stress. So this slide just has some preliminary findings. I'm gonna go ahead and just talk through it a little bit. The graph is a prediction of child mental health symptoms based on different types of exposure to the spill. So the types of exposure that we captured in the survey are first indirect, so job loss or income loss as a result of the spill. And then we captured information about 3 different types of physical exposure. So smell, child direct exposure, and parent direct exposure. And so what we have here is, this is results from our 2014 and 16 waves, since 2018 is still in the field. And what you're looking at is odds ratios. So the orange is the more recent, 2016, blue is 2014. And this is the odds of a child having a mental health symptom, so anxiety, depression, trouble sleeping, or challenges getting along with peers, based on the type of exposure compared to a child who hadn't experienced that type of exposure. And as you can see, sort of down the line, the odds are greater for children that had experienced that type of exposure. In 2014, it's more pronounced, but it is still present in 2016. So I'm going to talk a little bit about the focus group component of RCYC. So last fall, we conducted a series of 6 focus groups with a subset of folks who had participated in the survey. So we invited them to have about an hour-long conversation to get a little bit more in depth with some of the questions from the survey. We currently have a tremendous amount of information in the transcripts that we're working to code, and we'll be able to use that information to complement the quantitative information that we've been collecting with the survey. So these are just 2 quotes that I pulled out from the focus groups that I think sort of illustrate the nuance and sort of variation in the types of experiences that the people that came and talked to us shared. So the first one sort of talks a little bit about cumulative trauma, or the experience of like layering of disasters. So we had someone who shared that they had been recovering from Katrina and felt like they had just sort of started getting back on track, and that was when they experienced the oil spill. And so they shared a little bit about that experience and what it looked like for them. The second one is experience from a parent who was talking a little bit about how working in shrimping and oystering wasn't working for them as much after the spill. So they sort of made an adaptation, took a different route, and started pursuing nursing. So it's just a quote that sort of captures that resilience and kind of adaptation, something that may or may not have happened whether the spill had occurred, but the person was connecting it to the spill in our focus group. And finally, I'm going to talk about our social media analysis. So RCYC is a partnership between LSU and National Center for Disaster Preparedness. They have been working on the social media analysis and have a sample of 500,000 tweets from 2010 to 2016 that relate to the Deepwater Horizon oil spill. The survey itself and in the focus group, we asked questions about social media use as well. And this graph, which may be a little small for the folks sitting in the back, this graph shows the most retweets per year that related to both the Deepwater Horizon and health. So in 2010, the most common theme was seafood, 2011, mental health, children's health, memory loss, new research, and so on. So it's just an example of what can be done with the social media data, sort of looking at how it's used to share information. And this type of analysis can also be used to complement the information that we collect on social media use in our survey. Just a couple of takeaways. So the spill, as Dr. Slack mentioned, has been associated with a number of mental health impacts. And these things operate differently for different people, depending on their social position, their household characteristics, etc. And they change over time. And I know I'm about to run out of time. I just wanted to sort of quickly go over sort of some research and resources available related to supporting mental health resilience in disaster-prone communities. So just sort of looking at more recent research, especially related to the spill, training for community health workers to bring awareness and specific skills to help disaster-affected populations. Also, others who are providing direct care in the primary care setting, so utilizing integrated behavioral health, providing mental health services within the family doctor setting has been something that has been researched, as well as telemedicine for folks that live in outlying areas and may have difficulty accessing health care and mental health services. And then I also included a link here because I think the slides will be shared. This is a link to National Center for Disaster Preparedness Resilient Children Toolkit, and it has a huge number of resources, flyers, handouts, videos, links, all sorts of things that can be used by teachers, anybody providing direct care, parents, to help support resilience for children of all developmental ages. Thank you.